We got Bev Dave here with you, also a special guest here, Beverly. We got Jason Kennedy, the Ellis County Health Director. As you know, every week everything changes so much. It's insane to think about how last week, we didn't have a case in Ellis County. There was just a few cases popping up here and there, and now there's 4 in Ellis County. There's still 4 in Barton County. Reno County continues to climb a little bit. There's more cases popping up here and there. So, Jason, man. What would you say as far as where we're at right now?
It's Dr. Norman kind of talked about this early on last week as far as we're still in the upslope of the curve statewide. I think the projected date for the peak was like third week to the last week in April. So we're still kind of in that upslope. We're going to see a continuation of cases even here in Ellis County. We had 1 case as of end of last week. Then now we're up to 4. I will say 3 out of the 4, like in the press release, 3 out of the 4 did have connection with each other. So it's we are going to continue to see some cases, but as you can see, really from the national level and from statewide or nationwide, we are seeing that some of the predictive modeling and some of the projections maybe were wrong. Or maybe had incomplete data to start out with, and there is some light at the end of the tunnel as far as they do believe areas like New York, some of that have actually seen their peak and are on the backside, and the projections are lower. So hopefully those hold true. If you look at Kansas predictive modeling, at least what the state's been pushing out, we have a fairly flat trajectory across it. We don't see a huge spike. We don't see huge peaks. We kind of see a sort of flat trajectory as far as a slow growth with this thing. And we do, I think the state's still predicting a peak somewhere maybe next week.
Okay.
That's positive.
Yes, it is.
I look forward to the peak because then after the peak you go downhill, right?
Sure. I think that's the goal. That's kind of how the peaks work. So hopefully we do see that. And really the key is to just keep the numbers to a minimum. No matter where your peak is, you want your peak to be low. And so if you look, actually the University of Washington's come out with some really good predictive modeling. I think the state is using their own, but it's actually based on some of that or similar data. Overwhelming the healthcare system was kind of a large concern. Well, if you look at the new predictive modeling for the state of Kansas, we're going to have about 10 times the amount of hospital beds that we actually need. We're going to have about 200 extra ICU beds over what we need. The last I saw, the number of ventilators was around 98, which is a number that is not overwhelming for the state of Kansas. We can take care of that with what we have on normal service. So it's, the numbers look good for Kansas. Like we talked early on, we're inherently socially distanced out here. It's we've got wide streets. Everybody has their own house. You drive your own car. We have a tendency to almost maybe be a little isolationist at times out here because it's easy. We have a fairly rural community. We have all those things working for us, which is why Hayes is awesome, which is why the state of Kansas is great. It's one of my favorite things about Kansas. We have a lot of open space, and so it works for us. It works in our favor as far as viral transmission. We also have the key piece that we've talked about from the start is washing your hands. Really self-care, washing your hands and not touching your eyes, nose, and face, staying home when you don't need to be out. And they've actually added in a mask thing. We'll talk about the mask, but it's those steps help keep that number low. They help keep that number low. Now, we can't prevent all viral transmission. That's just viruses are sort of hard to control like that. But keeping the number low, keeping the number of infections low, and then really focusing on those morbidity mortality indexes, which are also have stayed luckily fairly low with this virus. So, the key pieces are that washing your hands. Make sure you're getting that stuff off of you. Make sure you're not transporting that into your eyes, nose, or mouth. Is a really important thing to keep that number low.
Yeah, that sounds really good. Now, when you're talking about that, along with that distancing, it's still the chances if you do those things, even if you're in contact unknowingly with someone who doesn't know themselves that they might be carrying the virus, those things can in and of themselves also prevent that, or less likely that it would happen that you'd get that virus transferred to you.
Sure. And that's why, honestly, that's why we'll talk about masks. Masks help on that. The CDC is now recommending the use of cloth face coverings. And that is less to protect you from getting the virus. It's to protect other people from you transmitting it to them unknowingly. Mm-hmm. The mask is, those cloth face coverings are to cut down on the distance that the droplets will actually spread. Mm-hmm. So if you cough, sneeze, something like that, or just in talking, droplets do come out. Well, with that cloth face covering on you, your droplets don't spread as far. And so it's really to protect others around you in case you're infected and don't know it. So that's the currently why they started recommending the cloth face coverings. They're still not recommending using hospital grade face masks. It's like a homemade cloth mask, or you can purchase them online, things like that. So it's to cut down that distance that the virus can spread in those droplets. Now, with that, like I said, that doesn't necessarily protect you from the virus. It protects others from you. Mm-hmm. That is not a substitute for social distancing. You still need to keep that 6-foot distance. Just because you have a mask on doesn't mean that you can't transmit it. It doesn't mean that you can't contract it. You still need to keep that 6-foot distance, and you still need to wash your hands, because the mask doesn't protect you, but washing your hands does. You don't get the virus through your skin. You get it through your eyes, nose, or mouth. So if you touch something, you have it on your hand, then you put that into your eyes, nose, or mouth, that's how you get that. That's how you get the virus. That's how you transmit it. So washing your hands before you do that, or just not touching your eyes, nose, or mouth is important, but washing your hands is a key piece with that. I think early on the CDC guidelines said that about a third of viral transmission, you cut down a third of viral transmission with good hygiene practices, like washing your hands, not touching your eyes, nose, or mouth, and coughing into your elbow. Even if you're wearing a mask, those recommendations still hold true. Still cough into your elbow. There is still viral spread through that mask. You can still project droplets. You still need to be coughing into your elbow, those type of things, to really cut down that viral transmission.
Wow. Well, such encouraging news, and really that data that you shared earlier, very, very positive, encouraging. I just really appreciate that.
Yeah, see, that's kind of intriguing, because I think I would be one that would think, okay, I have a mask, I cough, the mask is the same as coughing my elbow, but it's not.
No, it's not. And making sure you wash those masks frequently. Anytime you need to wear a mask when you're around other people, but that means the minute you get home or not around other people, you should remove the mask and make sure you clean it. So maybe have a couple or something like that, so that you can constantly clean those things, because you also don't want to grow bacteria and things like that inside the mask and actually get yourself sick from the use of a mask. So, and all of the standard hygiene practices still apply even with that mask on, but they are recommending that if you're out in public or if you're around other people, the mask is an adjunct. It's a supplement to what you're already doing. It doesn't replace anything. All of the rules still apply, keeping everything that you do the same, just adding that extra piece in to protect others from that droplet spread.
Okay. All right. So along with the mask, adding that into the repertoire of ways we do that, more positive cases are coming in, right?
Sure.
So that means job with the health departments like yourself is getting busier and busier as you're doing all the contact tracing and stuff, right?
Right. I will say we have a great healthcare community here in Hayes, and we have a great group of citizens. We've this contact tracing piece that we do, basically what we do is we take a person after they're confirmed positive. So in this case, to become a confirmed positive, these people were symptomatic. They contacted their primary care physician. If they don't have a primary care physician, they called the Hayes Med hotline number. Then they work with their primary care physician to get testing. Once they get their test, the minute we decide you need a test, you go into home isolation, home quarantine at that point. You are not to be around anybody else. You are to be at home and away from others until you get the results of your test back. So we get you in, you get you tested. Test results come back positive. So we have 4 positives in Ellis County at this point. Thankfully, all of them are doing well, mild symptoms at this point, and actually a couple of them will be in full recovery by the end of the week. So,
Wow, praise God.
we, we have been fortunate with these cases. So, once you're confirmed positive, then you get a call from the health department. Well, you get a call from your doctor first and work with them on any of the medical stuff, but you get a call from the health department. And what we do is we try to walk through your steps, and we go back 48 hours pre-symptoms. So the first day you started having symptoms, we go back 48 hours before that. We start walking your steps forward to today's date. We try to identify every person that you have had contact with. And contact is defined as closer than 6 feet for an extended period of time, greater than 10 minutes. So walking past somebody at Walmart is not a contact. Just being in the building with someone while they were positive is not a contact. It's being within 6 feet for greater than 10 minutes because you need that time to actually have that viral transmission or have the likelihood of viral transmission. So once we identify anybody that's considered a contact, so within 6 feet, greater than 10 minutes, then we contact that person, the second person, that contact. We contact them, and they are in quarantine, mandatory quarantine for 14 days. The 14-day period is because the latency period of the virus, the period that you can be infectious to others or fully contract it yourself, is believed to be between 2 and 14 days. So we walk those steps back. We find those people. We recommend that they be in mandatory quarantine. During that period of time in quarantine, if that contact exhibits signs, symptoms, anything like that, they would contact their primary care physician and we would test them at that point. Once they get tested, then they become a carrier, then we would walk their steps back as well. However, the good thing is once we quarantine that original, that secondary contact, after 2 days in quarantine, they no longer should have contacts because they were asymptomatic. They've been in quarantine for 2 days. So that's the point of the isolation and the quarantine orders, is that if you yourself don't have it, you can't spread it. And if you do have it and you've had no contact with others, you also can't spread it. So that's the point of the quarantine and the isolation orders. So that's the process that we go through. And we really just continue going until we think that we've found everybody that has had contact with that individual while they were infectious. We will then monitor. So the isolations, the positives, we will monitor them every single day. We call them, we check their we make them check their temperatures, we record all that. The quarantine subjects, we do the same thing. We call them, we contact them, we say, hey, how you doing? We make sure they're not symptomatic and don't need to be tested. At the end of their quarantine period, so for people that test positive, it's 7 days after the onset of symptoms or 72 hours post-fever, whichever is longer. Those people are out of isolation. If the contacts, it's 14 days. If they don't have any symptoms during those 14 days, then they're back out of quarantine and able to resume the new normal, I guess would be the word for it, which is still maintaining the governor's orders, still utilizing stay-at-home orders, maintaining social distancing. All of those things still apply. So, and we've had a bunch of questions about, well, what if they were in Dillon's, or what if they were or what if they were in this certain store or something like that. Like I said, the key piece is that closeness of that contact, that 6 feet, being within 6 feet for greater than 10 minutes. It's not just someone that you passed at Walmart. It's not just someone that you passed while you were in the store. It's not someone that you maybe passed on the street or drove by in your car. Viral transmission doesn't happen that way. It's person-to-person spread. See, that's why that closeness of contact, which is why implementing masks, washing your hands, all of that stuff cuts down on that viral transmission, because it doesn't allow that to go person to person.
Okay.
Oh. Well, thank you for walking us through that. Jason Kennedy, Director of Ellis County Health Department, with us here on KPRD this morning. And just thank you for that step-by-step, this is what happens, this is how that works, because with all that detail, it really helps us to get a better picture of what it looks like to quarantine and what time you do that and for how long and how that stops the spread.
Right. It's, through all this, there's been a lot of information thrown at people via Facebook and other sources of maybe less than reputable information. I would really encourage, the same as I have every time I've been here, I encourage people to get good factual information. So pay attention to the CDC, the KDHE. KDHE just updated their website. All of this information that I'm giving you this morning is all directly posted on the KDHE website. There has been, there's ultimate transparency, at least as far as the playbook that we're all following. It's all posted on the KDHE website. You can go and read it for yourself. There's some great guidance documents, things on there. There's frequently asked questions, everything else that you can access right there, and it's true factual information. Sometimes Facebook doesn't exactly have the most factual of commentary, so making sure that if you have a question or you read something that is alarming or concerning, go look for the actual facts. Go to KDHE, go to CDC, find that information for yourself and make your own judgment. Don't let someone else give you your judgment.
No.
That's good. Good. That's real good advice.
Yes.
Very deep question for you now. Okay, so if I have to wear a mask, if I wear a Kansas City Chiefs mask, am I better protected? Because they did just win the Super Bowl now.
You know, I think that it's a high likelihood that if you're in Kansas and you're wearing a Chiefs mask, you are definitely better protected. I'm not sure what you're protected better from. If it's someone else that's going to sock you, I don't know, but I think it's probably a safe bet in the state. So go Chiefs, I guess.
Okay.
But yeah, it's right now making sure that we are caring to others too. I'll tell you what, it's some of these people that have been, or people really just nationwide that have been tested positive for COVID. There's a lot of fear in people, and fear sometimes works out in anger. Yeah. And these people, it's not their fault. Nobody went looking for this stuff. So making sure that we're caring for others at this time. And we have an amazing community here. We have so many people that are just so supportive of each other. You can see it in all the things that they're doing for downtown businesses and all the things that really the leaders in this community are doing to help others. And so I think making sure that we continue that, and we continue to care about our neighbors, continue to care about our friends, and continue to help each other through this tough time. Everybody has a different level of anxiety. Everybody has a different level of something, or how this is impacting their life. Yeah. And making sure that we all remember that, and that we really look out for each other and help each other out from a safe social distance.
Very good. Really appreciate that. That's amazing just to hear those basic truths, making sure that we build our actions and things on those truths and not on something that somebody shares that causes that fear that you mentioned. And it does show itself in different ways, and you hear about some of those ways, and you've got to be compassionate for them. But really appreciate that calming. This is fact, and make sure you have the facts. That's great.
Yeah. Hey, Jason, thanks so much for your time and help. And just know we'll be praying for you, praying for all their healthcare workers on the front lines, with their hospitals, doctors' offices, first responders, and so forth. Any quick lasting thoughts?
You know what? I think right now is a good time for hope, prayers, and for friends. Make sure we look out for each other, care for each other, and maintain that social distancing. As we work through this, these social distancing measures, all of the good hygiene, this will last for a long time. We will want to continue this until this virus is completely gone, and that might be a year and a half till we actually have a vaccine. So these processes and these that we're developing now need to be continued, even as we add more, and as we get back to some level of normalcy, which will happen. There's conversations going on nationwide about how we get back to life, how we get back to work. It will happen, and it will happen sooner rather than later, but we will still need to protect ourselves, we'll still need to protect others, and we'll still need to care about each other.
All right.